Sexuality was one of the topics that was, when we had a survey among our members before starting these webinars, that was brought up as a on the wish list, so to speak. And Alzbeta had a talk about this at the last EHA conference, and it was very well received. And it's a topic that, of course, not is always so easy to bring up, because it's really, you know, intimate in a way and private, and can be challenging for people to talk about. But for all of us, it's really an important part of life. And I'm very happy that Alzbeta is focusing on this from also her professional perspective, and with her close expertise and knowledge in Huntington's disease. So she's one of the few I know who do this. So I'm very grateful, Alzbeta, that you have agreed, because I know you are a busy woman running more or less mixing two clinics and really being busy in your life. So it's very, very much appreciated that you could take your time to be with us tonight. And please introduce yourself. Tell us a little bit, because many people know you of the participants here, but not everybody. So please tell me a little bit, or us a little bit, about who you are before you start. Okay, you need to unmute, my friend.
Okay, now I saw.
Yeah,
okay.
now you're on.
Hello, everybody. I'm very happy to be here tonight. And I'm very pleased to get this invitation and to talk about the sexuality. And I'm always very happy to do anything for EHA. And it's always fun. And I'm enjoying this time. And let's introduce myself. Some of you knows me, but my name is Alzbeta Mühlbäck. I'm born in Czechoslovakia, and I am living already many years in Germany. I am psychiatrist or neuropsychiatrist and working with HD patients and families already more than 10 years. So from the profession, I started in neurology, went to psychiatry, and then I end up over 10 years already with HD. That I can say touch my heart, and I'm doing it. I like this work, and I'm enjoying my work, and I'm enjoying this gratitude from HD families to be a part of them and to be able to guide them and to learn. We are learning actually from each other. I'm also, at the moment, I'm working as a psychiatrist. As Astrid said, I'm in charge of HD clinic close to Munich, as is the HD clinic with 20 inpatients bed, where we are treating the patients from all Germany with acute problems, psychiatric or neurological, but also having the ambulatory outpatient service, genetic consulting, and doing everything in once for HD families. And I'm also married to Ulm HD clinic, so I have two clinics that I'm connected to. So in Ulm, I'm also seeing patients and working on some research projects, on a research project about e-health, telemedicine, how we can improve the health of the patients with telemedicine solutions and all kind of these things, where we are also working close with the European Huntington Association. Today, I am pleased to talk about the sexuality that is part of my professional life. And it's something that I am discussing a lot with my patients. It's not something that I am discussing with my patients in the first consultation, let's say, but it's the topic if you have open and good trust relationship with your patient. It's something that is coming up, and it's something very important because it's part of us. So today's presentation, it will be something that I learned from my patients, something that I'm seeing in everyday life with my patients, and I am happy to present you my view, my observations, and it's also something like invitation for a conversation. So I would really appreciate to get your question, to get your feedback, to get your comments. Please write it in the chat. Astrid you can just put it in when you are hearing to the presentation. And if there are some questions, just go ahead and ask us, and we can comment on this. We can also have we can have a conversation, because this is something like a discussion should be, not something that I said to Astrid, I'm not giving a prescriptions today, telling you here is a prescription for 2 times sex 2 times a day. that makes you happy. That's not going to happen, but well, I hope that it will be useful for you, or maybe for some of your other families or relatives or whatever, anybody who is having some kind of issues. Good. Okay, so Astrid, I can share my presentation. Yes. You see it now, or is it still?
Yes, it's perfect. Now
it's perfect. Okay. Yep. Okay, great. So this is the first slide. I think we can skip this one because we have already been talking about this great webinar that we have each Wednesday, or is it always on Wednesdays? And today's topic, as we already say, will be sexuality and Huntington disease, but also the sexuality, and just let's talk about it. So I use some kind of picture because I'm someone that like art and nice paintings. And I thought when we are talking about the sexuality, we need to talk about Klimt. And the pictures that you are seeing, this is the Gustav Klimt from Austria. And those pictures are, I think, are like matching well with the presentation. So I hope that you like them as well. So we will just have a small introduction and just to think about it, why we should talk about the sexuality, how we should talk about this, maybe some case study from the clinical practice, what some common cases, some common issues, and maybe some kind of approaches, what we can do on the easy way. What is very important to me, what I'm always saying, all my colleagues and also my families that are visiting me, the sexuality is something very natural. It's something that belongs to us. It's part of my life, of your life. So it's part of our life, and it's also part of our patient's life. Many doctors cannot imagine this, that also their patients have a sexual life, but it's really like this. So we need to consider this, and because of it's something very natural and part of our life, it needs to be part of the conversation and needs to be a part of the doctor's conversation. So this is something what I would like just to point out, that why it matters. And it's also something that affects both. It affects our clients and patients and also their partners. So it's something that we need to be talking about. And it's important from this kind of perspective because it's not that it's a problem that is only a patient having, but it's also the problem that is partner of the patient having as well, or issue. A lot of people ask me, or my colleagues even ask me, why we should talk about this. Maybe there are some kind of other platforms or chats where you could just take a chance and talk about the sexuality. But it's important to point out that the patient-doctor relationship create a really excellent platform. When the relation is trust and open, I think this is something that you can use to discuss this, and it's very good to discuss the sexual issues. And what is good about this kind of topics, doctors can even, or the therapeutists or the psychologists, any kind of people that are caring of patients. It doesn't have to be necessarily the doctor. It can be also the physiotherapist. A lot of them can have this trust relationship with the patient, and they can talk about the sexuality, and we can provide support, and we can find solution. This is very nice about the topic because you are always happy if you can find some kind of solution, if you are giving an advice and it's having some kind of effects. Sometimes it's difficult that we are giving advices and the effects are not coming. But in this topic, it's really like this, that if you provide the support, you can find proper solutions. Somehow, the sexual dysfunction, that's the term that I'm using because I don't really like to use the term problem because problem is something big, you know, for the patient. You say you have a problem, it's something like, oh, problem. To having a problem, it's not good. Dysfunction is something not functioning, but it can function again. So, but it's the matter of the vocabulary. but somehow we are not talking about these kind of issues. And we sometimes neglect sexuality. A lot of my colleagues or the patients or the partners, they feel that it's like part of our life, that it's somehow, they pretend not to have this kind of problem or issue. This is not a, even if the sexual dysfunction is something common, and it's very common in psychological disorders. We are not talking about HD, but we are also talking about depression, anxiety, sleep disorders, or other neurological diseases, Parkinson, multiple sclerosis, or after stroke. It's something that is very common, and I think it's very important to give the information that is the problem, that it's common, and it's not like the HD people could have a problem with this. It could be an issue for any other psychological, neurological disease. And what we are not doing, it's when we are finally asking the patient or asking the families, we ask the question in the way that it's like the answer is just yes, no. So we ask, do you have some sexual problems? You know, if you ask me, do you have a problem with me? I rather say no. So if you ask, do you have some sexual problems? It's like very straightforward question. It's very direct questions. So the patient has no other choice as to say rather no, because it's like too direct. You are too direct. You need to invite your patient for a conversation. You need to introduce the problems, and you need to make some kind of introduction telling, well, there are sometimes issues that a lot of people are having with anxiety, with stress, with depression. And it can be that there's some kind of sexual issue or dysfunction, and those issues are common. So I was wondering if you are experiencing some of those troubles. Is this issue in your case? So I think if you make this proper invite about the topic, this is much better, because in that moment the patient is feeling, okay, I'm not alone. There are many of those that are having the same kind of troubles, so I can even answer yes. So it's different, just like a simple question, do you have some problems? And we need keep talking and we need just we need just ask questions, and those questions need to be really open questions. So I think it's very important for us to know, how is the relationship in the family? Are there some troubles? How is life with your partner? What is your partnership like? Those are all questions that you can ask. They are like open questions. And it's something like bridge to sexual issues, that you can just continue and ask about your sex life. Are you satisfied? If you are not having a partner, how do you meet your needs? Do you know some masturbation techniques, what you can do? So those are some kind of very, very natural questions. And I can guarantee, if you ask as a therapist one of your patients this kind of question, they feel relief, because they are actually waiting for that kind of questions. There are less of the patient that wouldn't answer. Most of them, they look at you and then they start to talk. And if you encourage them and you ask some more questions, you are also really receiving answers. And you just need to avoid yes, no question, and you just ask many of open questions, and the conversation is running. And you don't even need some kind of special effort for this. Sometimes is the question when it's the time to ask. And I know there are colleagues or therapists or psychologists that they are not really asking the patient, or they are not asking the question. And a lot of people ask me, what do I do when my doctor is not asking me? It can happen that they don't ask. So you can start a conversation. This would be A. For B, you can take your partner with you and your partner starts a conversation. That's also a good possibility. Sometimes it happens to me that there is a partner in the consultation and the partner is asking questions, for sure you can teach your doctor to talk about sex. So you can say, this is important topic, so you need to learn this. And you can also looking for an alternative doctor or some additional consultant to consult these issues. It's not a problem. But this is only fun, or you can ask your neighbor. Normally, the neighbors are the ones that know everything. So you need to decide what you are going to do. But I would basically, all options are correct, but I would go maybe for the first ones. And you start a conversation if your doctor is not asking, or you take your partner with you and you let your partner to start this conversation. But there is always the way that how you can start this topic. And sometimes it can be that it's not like that your doctor or your psychologist wouldn't like to ask you about this, or they just don't have it on mind and they don't think about it. So you are the one that needs to start this conversation because they just don't think about it. Once you start, it can be a very fruitful conversation, and it can go very well, but sometimes they just don't think about it. And what is very important, you need to practice this. You need to practice talking about sex. It's something like a lot of things. Also, if you are practicing sex regularly, you will get better. It's like with everything. It's like riding the bike. It gets also better and better. And then also you can ride without your hands at some point. If not, it's also not bad. But it's something that you need to practice talking about sex. And also, it's maybe something that you can start to practice with your partner. And then you can, if there is an issue, you can just move forward and just to start to talk with your doctor. And I'm always saying, when you are thinking about one of your usual problems that you know, everybody of us has some kind of problem, some headache, stomach ache, or some diarrhea, itching, allergy. Somehow we have some kind of troubles or some kind of pain or hip pain or whatever. Some kind of issue has everybody. And those are the things that we are like talking very well about. We are even talking with neighbor about our headaches and migraine and whatever. So you just need to think in from the perspective that this is also part of our lives as the sexuality. This is also part of our life. So if we are talking about a headache, we need to learn to talk about the sexuality. I have a guide for the patients. So you are always, when the patient comes and describe the symptoms, when it comes to the physical problems. So for example, this is a description of a patient talking about diarrhea. They are very precise, and they are telling me, I have a diarrhea, it's really bad. I can live with it. It's like very disturbing me. My partner is suffering, my life is turned upside down. You need immediately to do something. I need to find a solution. So they know immediately that you need to do something, because it's something like it's bothering, it's really bad, or if they are having a headaches. So they describe the problems very well. So always when you want to talk to your doctor about the sexuality, you think about your physical problems, you think about your headache, or you think about your allergy, and in the same way you describe your troubles. So you will say, I have a sexual issue, it's really bad, I can't live with it, it's really disturbing me, my partner is suffering, my life is turned upside down, I need immediate help, we need to talk about this, we need to find a solution. So easy it is. So this is the way how you can practice and how you can learn to talk about sexuality. Yeah, also the young colleagues, young doctor's guide, they have sometimes also some kind of problems to ask these questions, because they somehow feel uncomfortable to ask the patient about the sexuality. So I'm always saying, well, when you are asking your patients about the headache, you can be also very creative, and you are asking, how often do you have headaches? What kind of type, pressure, intent, how intense they are? How often do you take medications? Whatever, we are asking a lot of questions when we are asking about the pain of our patient, when we are asking about the sleep disorders. When do you have a sleep disorders? Why you are having sleep disorders? Is it every night? Is it sometimes? Is it on the weekend? Are you stressed? So we can ask a lot of questions. So we need to think about those everyday questions that we are asking. And in the same way, as we as professionals, we can also learn how to talk about sex. So I really believe this is something that you can practice. And if you practice, you will improve yourself. At least it helped to me for a few years ago. So it's something that can be really done. There is also the reality, and I think it's nice to present something that we are, any of professional is experiencing in every clinic, everyday life in the clinic. For example, this is the young woman at age of 35 that she told me that she does not have an orgasm, and this is a problem. What I really believe that it's a problem for her, and she's a person at risk of HD. So her first question was, is it HD? Why do you think because I'm a risk person is some kind of something that is connected to HD? You know, you never know what kind of questions are coming from the patient and what all they are thinking of, or the risk person. Her father died of HD, so for sure she has some kind of stress situation, and she has a full-time job as a project manager, and she suffers from anxiety and panics. So she's taking antidepressive medication. So she was considering what she should do. She was even talking to her GP about it, and he was advising her to stop the medication. On the other hand, she's well, so she's considering, should I stop the medication? Is it a good idea? So she's a little bit like not sure what would be a proper solution. So we were talking about this, and I was asking more questions. You need to ask more questions to understand the situation. So I was asking, when did you notice the first changes in your sexual life? What kind of issues? What is your relationship about? Do you have sex regularly? Also, sometimes it's important to ask, what do you consider to be sex? Because it can be different ideas. People have ideas how long it needs to take. For some people, it needs to be an hour of hard work. For somebody, it's maybe 10 minutes. So we are different individuals with different needs that we have. So this is good to ask, so you have idea what if you are talking about the same thing with your client. And you also need to ask, is this only a problem, or is it some kind of problem that you don't even, some other problem in the relationship? Is any other things are running well? So there are many questions that you need to ask to understand the situation better way. And it is not a long conversation. It's not like a conversation that you are talking to your patient like 1 hour. It's like in 10 minutes, it can be very effective, and you can discover that she's always exhausted in the evening. And then she tries to motivate herself to have a sex because she feels, I need to do this. Then she's afraid that it will not work, that her partner will be disappointed. And, you know, she's getting in some kind of thought that, oh, I'm not going to do it in a good way. Her head is busy. She's not relaxed. She's really under pressure. And this is making even the situations like really, really bad for her. So we were discussing, and we said, okay, we will keep talking another 5 minutes, or we are in conversation for 15 minutes, let's say. And I knew that she is really active, and she's jogging every morning. And then we got to idea on the weekend, maybe instead of jogging, she could try sex. It could be same, such as similar exercise in one way. And then maybe, because she had in her idea that sex is something that needs to be done in the evening. But, you know, sometimes if you talk to the people and you bring some new approach, And this was not some kind of difficult approach to advise that, why don't you try it instead of jogging in the morning? And why don't you think about this and you talk to your partner that you have sex without orgasm, that you just try hugging and touching and feeling yourself. So just to relieve the pressure. And in this case, I'm presenting it because it was working, it's some kind of success story. So this was something what went well, and she didn't even have to change her medication, and she continued to take her medication, and it went well. And it was just only small changes, like sex on the weekend in the morning instead of jogging when she's not stressed. And it's like also sometimes the way how we are thinking, how we are approaching this. And sometimes we don't see the solution, even if they are like very close, because this is the way when we didn't think about it. So this is the easy help. And so this identifying problems is very important, or to identify the issues, and then you can even together with the patient look for the solutions. And sometimes these solutions are not very difficult, because what the most of the cases that I'm seeing, it's like lack of satisfaction or reduced desire, lack of orgasm. People are frustrated, are tired, are exhausted. This is the most of the cases. You can find a solution when you just think about the timing. When you find a proper timing. For some people, it's better to have a sex on the weekend. For some in the morning, some in the evening. So you need to consider the best timing, individual timing, or you need to look what is good. Maybe some kind of regular exercise. Yoga can be very helpful for the women to get the sexuality back, to feel the body. This is also something very nice. Even, or you can think about if somebody is having depression or panic attacks, to think about the psychotherapy instead of the medication first. You can get this also good in, you can find a nice solutions. Changing the way of thinking, it's very important. As I'm always saying, this is not like a goal oriented. It is not some kind of competition that you need to have it once a week as a prescription, and you go ahead and you go home and you just need to do it. You just need to think about the pleasure. So whenever it happens, it's good. And if it not happens, okay, it's not okay, but it happens maybe next time. And it's like even to feel each other is pleasure, and it can be considered to be sex without orgasm. I'm saying my patients. So you shouldn't always think about this. The sex is only this when we have to have like 5 orgasm in one row or something. you need to think about the pleasure, not about the goal, what everything you need to reach. What is also very helpful is to consult the couple together. So because then you get the better views and you can find a solution that are fitting both. So if you are talking to the couple, then if you offer some kind of solution, you see immediately if the partner is like saying, oh, this is a great idea, saying, oh my God, what kind of solution is this in the morning at 6? No way. So you get some kind of feedback. And I'm always saying, as a psychiatrist, so I have a lot of patients on the medication, and this is something what is like shared decision medication. And if you are unhappy about your medication of any kind of reason, you need to tell it to your doctor, because what I think it's not very useful is if you just reduce your medication without talking to a doctor, or you just don't take your medication, what is happening quite often. So then it's better to do it in control way, that you are just discussing this and you look for the solution. And I think every psychiatrist or neurologist or physician has no problem with it to discuss it with you and to look for the solution. So this is something that needs to be consulted with your doctor, and there is always some kind of option or medication change or whatever. There is always a solution. sometimes what is very, very often what we see is that a couple are together and somehow it happens that they don't have a sexual life. You know, you have a kids, you are very busy, then you can have a trouble with HD, or you can have a trouble that you are taking care of your parents or whatever. So somehow you are busy in your life or you are doing your career and you are such exhausted that you somehow forget about the sexual life. And then is the question how I can get back in sexual life. This is the most common topic that I'm talking with many couples, and they are all the time asking about the recipe, how we can do this. And they are always saying, yes, we both want to, but I have some strategies that can help get intimacy back in the rhythm. But what I'm saying, you need to switch off autopilot. You know, this is not something that will happen from alone. If you put your relationship on the autopilot and you just leave it on the just on standby modus and everything is running, it can happen to you that's at some point you are sleeping in two separate bedrooms. So you need to consider this. You need to be active and you need to have a motivation to get back in a sexual life. In the beginning, it can be very difficult. And I know what I'm talking about because to sometimes I'm having a couple in my consultation, there's like two strangers, two people that come, they are living in one home, but they don't hold their hands. Everybody is having the activities, the things that they need to do. They are taking care of the same children. The children are always same, but somehow they don't do many things together. So you need to know that your sex life begins outside the bedroom. So it's not like you need to do things together. And sometimes we start with so small activities that I am advising. You need to go for a walk together. I start always once a week, 30 minutes activity together. In the beginning, for many years ago, I thought the people can start with the weekends to do something on the weekend together. I was very optimistic. Then I find out that it's like too much. So we start with 30 minutes. You say, okay, you go out and you walk 30 minutes together. This is then on the second time. So you say, you go out, you walk together and you hold your hands when you are falling asleep or whatever. So you start really in small steps. And if they are both motivated, you can get success that they will find back to the intimacy. And sometimes you need to advise to do something like that sex needs to happen. You need to schedule the sex in this time. Did you say, okay, at least you need to try to lay down together and to lay to each other for at least, or in the beginning, because it's very difficult for the couple that was not having a sexual life for, let's say, a couple of years or 3 or 5 years. It's very difficult because you are like telling somebody, you need to go and lay down with the strangers that you married for 20 years. So it's really difficult. So you say, okay, you watch a TV together, you lay down together, you sit on the same you sit next to each other, and in this way, slowly, you maybe it happens that the sex life comes back. Sometimes when the couple is a little bit more motivated, you can also schedule sex and you say, okay, you should try it like once a week, Sunday morning or whatever, you can find some time. On the other hand, you need to be considered to find the best time. So if you are prescribing a sexual life to your patients, you need to also prescribe the best time for it. You should also talk about this with them, what is the best time, and you should plan. And then you need to consult the couple so they both feel comfortable for it. You also need to tell them that they need time. So if some issue happens in 2 years, that in 2 years the couple get apart and they are not having any kind of intimacy together, then if it's 2 years, then it can take another couple of months or 3 or 4 months, maybe even half year, till they get this life back. So you need to discussed this, that they need to take their time and they need to build their desires. Before and during sex, they need to ask what feels good, what feels not good. So they need to share the thoughts, they need to share the experience. And then I think very often it happens that we have also success with this. But getting a couple back in sexual life can take months. So we need to be patient on this topic. Then there is, I thought that if we present a young woman, we should present a young man. So we present a 47-year young man. First, I put the old man, then I 47 years old, and I said, oh no, it's not good. We have to put 47-year young man in early stage of Huntington disease, reported erectile dysfunction. This is also the very case that we are seeing very often in the everyday clinic, or if you have a good relationship to your patients, they are talking about this. For a man, it's very distressed and they feel very stressed. Even if his wife is very patient and supportive and she would do everything, he feels well. Somehow he feels very, very stressed and under pressure, and he cannot even describe it why. It's sometimes it happens that female patient can describe the symptoms better than male patients. Maybe women are more talkative, but even in men patient, you need to just need to keep the conversation, and in further discussion, you can find out that this person is as well very stressed, has some concentration deficit. He noticed that in his job he is not able to work on more than 2 tasks at once, that everything is that he's somehow lost in his thoughts, that he's afraid that he will be not able to have a sex and achieve erection, but it's very distressing. And he is very stressed about that he cannot satisfy his wife anymore properly, and she will find another lover or whatever. The patient head can be very creative on this topic. What everything can happen if you are not functioning well. So this is an issue in a family. And even if this wife is very supportive and telling this is not a problem, it can be it can be a problem. And you know, with this person or with this patient, we're discussing the sex. This is something like the sex is multitasking activity, because we are doing a lot of things at once, even not knowing about it, that we are hugging, kissing, putting off our clothes and laying down. And so it requires certain concentration. So we need to concentrate and we need to do 3-4 activities at once. So it can make you a stress. And we were talking with this couple about this, and we found also a solution for them. So I'm always saying that you can also divide the sex into several small steps. Then it's easier to concentrate. So if you say, okay, before we start to have a sex, we just take off the clothes, then it's easier. You don't need to think about touching, and then on the same time, you know, to take off the bra can be very, very difficult even for 20-year-old male. So the solution for this couple was to take off the clothes, to lay down, and then to start. It solved a lot of problems because it was easier for this man, and then he could fully concentrate on his activities. He didn't have to consider how he will do this, and he was also thinking about, he divided sex into small steps in his head. I never got information on these small steps because sometimes the patients are not so talkative. So, but it was working, and it was also some kind of pressure relief for him, because the solution was, okay, we do it in that way, and his wife found it as a very good solution, and she didn't she didn't say, okay, this is somehow weird. She said, this is a new approach. Let's do it like this. We don't have to do some things, but we did it in one way, like for 10 years. Somehow the couples have normally the sex on the same way, like for many, many years. And this is like always the same story for many couples. So sometimes it's a problem if you have some kind of habit to change it after so many years. But I say always, believe me, if you talk about this, you can change habits even after 10 years and you can make the habits easier. And I'm always saying, this is the aging. This is not some kind of problem. This is the aging natural process that we have. And everybody needs to change this. You need to adapt to your aging process. So this is something normal, just natural.
I'm thinking, Alzbeta, if I can interrupt you a little bit, I also am conscious of time. Maybe it's time for a little break.
Okay.
But I'm thinking that what I experience that people can talk about is really that, I mean, the disease that you are saying, age is changing us. Obviously, that's the case. But Huntington's disease is also causing changes in a person, which can be really, you know, complex, interfering in the intimacy and in the, you know, the communication that sex is. So maybe we can discuss that a little bit after the break. I think it's time now. It's really nice to take a 5-minute break if you're okay with that.
Yeah. Okay. Or
and
maybe also 10.
Yeah.
Whatever.
No, I think 5 is good because it's not
5
so
is good.
5 is good. So come back here in 5 minutes, everybody.
5 minutes.
Yes. You were bringing up in relation to talking about this topic, Alzbeta, that there may be different, I mean, traditions or cultures or whatever.
Also the different, you know, also the different families, because we have also in Germany, but also in where I come from, Slovakia, or from in Czech Republic, there are some families that are like very strict Catholic. And if you have this kind of background, it's more difficult for you to talk about this. It's maybe in other part of the Europe, they don't have this problem, or it's maybe in Scandinavia, you are more open to any kind of the topic. But this is something that you really need to learn. You need to learn to talk about the sex life. And as I said, the sex life, it's even not so difficult to talk. What is very difficult to talk, and as Danuta said, we have a lot of patients, like young patients, that have a juvenile disease. And they also have their needs that needs to be met. And to talking about the self-satisfaction and masturbation, this is something very difficult. And this is something what is very natural and people are basically doing. And young males are doing this. And they need it also for their, you know, you need it for your, like for yourself to feel like a male. You need it like for your personality. It's something very natural. So I have to tell you, experience from my clinic, that even if we have a young male patients, we look that they get something like private time, and we even provide with the magazines for it. And we say, this is your time. You can enjoy. You can do whatever you want. You can look for the self-satisfaction. This is something natural. Do it because it's good for you. And I think it's something very important that needs to be talked about, because you cannot think that if somebody is in advanced stage of the disease, the sexuality is losing its way. Maybe it's a problem that there is not a partner for you anymore. From some way, a lot of relationship, they break down and the partner is not there.
Yes, or the partner may be there in a way,
as a carer.
Yes, the roles are changing and the relationship between the partners are changing because the disease progresses. And that can happen from an early stage, I think, Alzbeta, because being intimate is really, you know, dependent on the, I don't know, it's like a dance. So it needs to work from both sides in a way.
Yes.
So that can be really challenging, I know. And I think I just want to read to you something Deborah has not asked, but commented in the chat, because it it touches upon some of this. She says she's an occupational therapist in the United States, and her husband had HD, and he was very affectionate, because that can also happen, I guess, that the arousal or the really desire can also be a little, what should we say, unlimited or
Unlimited.
yeah,
Yes.
or somehow. Can you comment on that first?
Yes, it's really like this, that mostly in the prodromal stage, on the early stages, it can happen that you get more affection on the part of the brains, that you are getting very lot of you have a lot of desire, and you could have basically a sex every day, maybe twice a day, and this is something that your partner cannot do. We see this also here, but I would say I see maybe I have a 50 consultation or 100 consultation, only one is having the problem to have too much desire. But those are the topics that always come out, because this is something very difficult for the partner. So you get this information on this very soon. Information when there is no desire is something that can that is hidden for a long time. So this information you receive as a doctor very, very late, or when it's or if you ask. But if there is too much desire, it's also a problem. And what we do, we are talking to the both partners, and we are also, because I had a couple when there is a partner having too much desire, and he was thinking about the sex every day, and his wife was after the operation with the cancer, so it was not possible for her to do it even once a week. She was not able of it. So then you need to discuss it, that is the fact, and she cannot provide it. And then you need to talk about something like self-satisfaction, that he needs to masturbate and he needs to do it on his own, because she needs to recover. You need to explain, and you need to also explain him there is no way of him doing this like every day. And he even decided for himself that he asked me which kind of antidepressive would make my desire down, which is the worst one for this. As a side effects, so you can even work with the medication, and you can look for the proper medication to get this kind of impulsivity or this kind of behavior under the control. So because this is sometimes like a maniac behavior, that they cannot really control the feelings. So there is always also possibility on this, which to work with the medication. If the one, or if the patient is not willing to take the medication, then you need to talk about the behavior and what are the borders, how far he can go, what are the rules, and you need to define the rules. And sometimes you define the rules on the way that you put them on the paper.
Yeah.
And if the rules, first you talk about this, and if these rules are not working and they come to your consultation second time, then we even put the rules on the paper and we let the couple to sign the rules. So because otherwise so you do everything to protect also, because you also need to protect the partner, because sometimes it can be very disturbing if there is too much desire. But luckily, this is the problem that happens, but it's not like the problem that is happening all the time. It's luckily, but it's a problem that we get to know very soon about it, because it's really it can be very disturbing.
Can I ask something?
Yes.
Alzbeta, one of the things I was thinking is, as you said, you started your talk by saying I usually use the word dysfunction instead of problem, and I agree. It's much.
This is a very culture depending.
Yeah.
I was talking with my colleague from States about this, and they told me in US, problem is a big problem. So they would use issue or dysfunction. So this is very different in which culture, in which language, which I think in some countries is problem, not a problem.
And I was
Dysfunction
going,
would be much worse because it's very medical. So I think this you need to decide for yourself, for your culture, for your language, what is the best way. I don't know what would be in Spanish the best way.
Portugal. Don't mix Portugal with Spain.
Sorry, it's Portugal. That's the question, what would be the best?
No,
You know.
I'm kidding. No, but I was wondering, one of the things is because as you said, there is also with aging, with normal aging, there is a dysfunction and loss of function in many ways. So
Yes.
is it more difficult to deal with these issues when the couple is older? So do you have different approaches with younger couples or older couples?
Yes, the erectile dysfunction is something what is happening in male population with aging naturally. For example, if you take the population of male after 70, 50% is having problems with erectile dysfunction. So it's quite many, it's every second. So even if you are talking to the male population around 50, you can have around 1/3 of them having already erectile dysfunctions, or they achieve the erection, but it's not lasting for the time that they would like to have it. So it can be like a shorter, or it's not like for the time that they are used to it. So you need to consider this if you are talking to the male patients, and these kind of problems in combination. Is it aging when they are like already around 60? Is it this kind of problem? And there is also one slide about this, but erectile dysfunction can be in 1/3 of the patients. You will find some kind of physical condition. So we need to send this patient also to consult the urologist, or you need to look also for some kind of physical issues. You need to prostata or whatever. You need to check on these things. You cannot say only, okay, this is like only your head. Because we know so there is a different approach if you talk to somebody who is 20 and if you talk to a male 60. So you need to, there is an aging problem or the aging difference already. For sure, the HD is making it more difficult, and sexuality is something, as Astrid said, that needs two of us. Yeah. As we are saying to the couple, the two have to be involved and they have to be motivated.
But again, the aging spouse, the spouse is also older and probably less flexible or less adaptable.
Yes,
I don't know.
This is always very individual. What you need to look at also, if sometimes the females, when with the aging, if they turn to the menopause and the hormones are changing, you can also have a problems that the vagina is very dry, so it can be very painful. So you need to talk about the lubricant. So you need to consider this aging factor. All this need to be considered, and you need to talk about this like on the individually. But there are many couples having like really healthy sexual life also in age of 70 without any problems. But it's maybe if you are 70, you are not using some kind of Kama Sutra to try different kind of stuff. You are like more realistic, what is possible, what is not possible. And if you are after the hip surgery, you consider what is good for you, what is not good for you. And these are the facts that you need to also discuss with the couple. And I have to say that in the clinical practice, the most of the couples that we consult are like people that are like in young couples, in more like prodromal stage, or even under the pressure pre-manifestation, or only people at the risk that are like under the pressure because due to work or job or whatever. Then the early patients, when they still would like to have a healthy sexual life, but it's not working. Sometimes we have these cases where there is too much desire, and it's a problematic for the people.
Because I'm thinking that if I can interrupt you in this, because I'm thinking that there, from my experience, what I hear from the support groups or the groups where this topic is discussed is that there may be a great difference there in between those really early or at risk or just being pre-symptomatic in their relationship, and to those who really have started to develop symptoms where the partner really feels it like a burden in a way, to still feeling kind of pressure to be a sexual partner because they feel that the partner's behavior has changed so much that it doesn't feel good for them or right for them. And Deborah had a funny comment, or her husband, the deceased husband, had a funny comment that he was a human vibrator. I mean, he was. So I mean, we need to take care of both parts here. That's just my point.
I believe basically you would, if we talk about the sexuality and HD, it could be done on the way that there's a separate group or the separate talk to talk about the pre-manifest early, then to talk about the advanced cases, to talk about the approaches for the juvenile. This is very young patient. This is a complete another story what we are seeing, because they don't even have the chance to develop a relationship. They don't have a partner, but they have a sexuality and desire. So this is another story. And then also to talk about pathologies. Let's say I didn't bring any of those here when it's too much desire, or if the sexual behavior is not proper, it's disturbing the others, or people are, touching the nurses or whatever. This is something that can also happen in advanced stages where the people are not, the behavior is not under the control. But I think this is something that would need to be discussed in the separate presentation to talk about. But I'm happy to answer the questions. Not a problem. Okay, are there some questions, or should we continue?
Oh, you have more? Yes, please continue.
We can continue. Yeah.
This is what we just discussed together for just a minute ago, that there are some other issues to consider. And whatever, if we talk about the aging, but you don't even need to have an aging to have a cardiovascular problems. You can have a problem with cardiovascular issues even if you are 30, so it's different. So you should always think about examination, neurologist, or to look on the pelvic region, hormonal dysfunction, testosterone deficiency. So even this kind of test we provide in the clinic, we look at some kind of also endocrinology, hormones, if that's everything working well. And also you can refer your patient to other consultants to be sure that there is not some kind of physical condition that is making a problem to this, why is sexual life not working. And also the lifestyle factor, I don't think that I need to comment on this, but also what can be a problem is alcohol, or the marijuana is very popular at the moment in Germany. I don't know how it's in other regions, but it's difficult, if you smoke a joint, to do some kind of activity afterwards, because you are so relaxed that everything is relaxed. So any kind of the drugs or alcohol or too much smoking with the cardiovascular problems or overweight, that can be something that can make your sexual life also difficult. So we have this problem with HD, and we have the problem with our thoughts on our head and the pressure that we are feeling every day from our life. But there are also the other issues that need to be always considered. And in many countries, there is something like sexual therapists. They are the expert, like real experts. That's the topic what they are dealing with. So you can even look in your region if there is a sexual therapist, and you can inform your patient about this possibility. Because sometimes patients, they don't know about this, that there is somebody like this. So it's good to have a look in Google, and I was very surprised how many of those keeps also in Germany, but it's very country and region dependent. I have one more slide about the erectile dysfunction, because this is something that is very common. And that's what we were discussing just also a minute ago, that is the difficulty achieving or sustaining the erection. So it can be sometimes problem that the male patient get an erection and everything is good, but it takes only not enough to achieve an orgasm, so that it's like taking maybe only a few seconds or a minute or whatever, so it can be a problem. And in most of the cases, a combination of physical and emotional issues. So this is both. So, and this erectile dysfunction, it make it more difficult because then you have lower sex drive, lower desire, you are very stressed, and your depression, you are depressed, you are frustrated. So it's like very complex problem. And it really affects a main relationship with the partner enormously. So it's something that you need to take care of as a doctor. And you need to think about this. 1/3 of erectile dysfunction is caused by physical problems. So you need to think about this 1/3. And those are the issues that you can sometimes even get that can get better. And what I'm very surprised, I am also asking my patients, because patients are very creative, and sometimes they are looking for the solution on their own. So they are taking Viagra or any kind of those. I think I named all of them, what are available in Europe. So you need to really directly ask, do you take any medication to help yourself? You need to be, and sometimes they get it somehow on the prescription, or you can even buy it on internet, what I was very surprised. So it's the way how you can get it. So you need to you need to talk about this. And if you prescribe this to your patient, we have the patient where we prescribe this, but you need to be sure there is no cardiovascular risk. You need to check the ECG to be sure, okay, this is a proper medication. And you also need to explain on this medication how to be taken, that you say, okay, we are giving a lot of tadalafil, this Cialis. You can say, okay, you start with a small doses, maybe 5 milligrams. You try it with yourself first, not with your partner. So to have a success, so you take this medication, you wait a while, and then you try to masturbate to see if it's working properly, if the half tablet or the small doses was okay. If not, next time you tried like the 10 milligrams, or you take the one more pill, and then you try it again on your own to see when it starts to work. Do you need like 10 minutes? Do you need 20 minutes to get the feeling for this medication? And then if they experience that, they know how it works, how they feel about it, when it starts to work, how long it works, then they feel more comfortable with this, and then they can try with the partners. But normally I advise on the first try to do it with yourself in the private hour when you have your time. And this is something very important what you need to advise your patient to get success, because sometimes you prescribe this medication, and this is not like the recipe for everything. Like this is not like magic. It's almost magic, but not the magic. Yeah, it's a magic, but you need to get the proper recipe to the magic. So you advise this, how to do it on your own, how to try it, how to get the magic to work, to get to know, to experience it. And then you try with your partner. This is something very important. And it's very important to check for the cardiovascular risk if everything is okay, because there is some kind of heart attack risk, as we all know, with Viagra. So there are some important facts to know about this. Do we have? Yes. As we promised already to Astrid, there is something that we are about to write about the sexuality. The project work is in progress. There is also the German Huntington Association that is very interested on the project, and they would like to have it in German version. And I told myself that it would be a nice Christmas present for the community. So
Wonderful.
I have my co-author sitting here with me, Wiebke. She's also writing. She's also participating on this. So she will keep eye on it that we have ready till Christmas. She's laughing, but I think it's something that we should do, that we should talk about sex, that we should find a solution, and possibly the first version will not be perfect, but I think if all of us will read it, go through it, comment on it, then the second one will be even better. So I think we can improve on this topic, and there are a lot of information about all kind of other topics. So I think it's a time to get information on sexuality.
Yeah.
To do more for our well-being. So, Gustav Klimt, we had a lot of nice women here on the presentation, and this is one of the first painting from Gustav Klimt when he was also looking at. I think the males are looking as well good. And this is the last slide. Thank you. And as your sexual life matters, that I think it's important that everybody needs to know. Okay.
Thank you. Really nice, Alzbeta. Really nice.
Thank you.
I don't think we have any comments in the chat, but if any one of you want to comment or ask a question, you're welcome. We are not more people. You can just unmute yourself and come forward if you like to.
I have another question. I'm sorry, it's my last question.
No problem.
I just would like to know if you see there are any particular challenges to when couples are trying to have kids, HD-free kids, if you have experience about these couples, if they have other needs or challenges.
There are two sort of couples. They are the couples that having a child is already a very difficult topic if there is one person at the risk, or if the one person is the carrier of HD. So many of those decide for a pre-implantation diagnostic. So it's on the way where there is no sexuality in achieving a child. So in the way that they do, like it's not, they really do it in pre-implantation diagnostic. So there is a sperm or the eye cell collection and implanted the embryo. The embryo is then examined and then implemented in the to the female. So there is no sexuality. So if this is happening, this also is pressure, because sometimes it can be very difficult process, and this is not working. Often is not working on the first time. Sometimes we say like a cycle that they need to go to 3, 4, 5 cycles where they get like HD-free child. It also a very financial, a lot of financial effort. It can cost a lot of money. So the couple can really get some kind of financial problems because of this. And in that time, this couple is so under the pressure that a lot of those couples, they don't even have any sexual life, because they are so concerned about that everything has to run well. And if the embryo is implemented in my body, I cannot do any kind of movement, and they are so under the pressure. But I think this is the same also for the couples without HD. All the couples that are like doing this kind of process of getting child, it's very stressful.
And also, it interferes with normal or the natural sex life, natural, because
Also, there is a couple that decide to have a child, and then they say, okay, we will examine once I'm pregnant. I examine the child if the child is having HD, and then I decide if I want to for an interruption, or if I want to stop the pregnancy. That it's possible till 12 weeks, almost in all countries of Europe.
Yeah, we had this on the topic in a webinar.
Okay, so
just, was it last week actually?
Yes.
Yeah.
So this can be also very stressful. And otherwise, if the couple decides to have a child and whatever happens and to take risk on themselves, it also happens that they say, okay, we have this HD problem, but we want to have a child. Till the child is growing up, we will see if there is a solution. This is individual decision. But sometimes it happens that the couple cannot get pregnant, or the female cannot get pregnant. That also this kind of pregnancy problems can occur in the couple, or in couple where one is affected with HD. But I think this is the statistic, like in not affected population, that it just happens that some of those people have very, very stressful life. So, and sometimes those couple are like very surprised because they were all the time thinking of, are we allowed to have a child or not allowed? And then it's not, then they decide, okay, we do it and it's not working. So this is, and then the sexual life is changing a lot because this is the same like with other couples, not affected.
Yeah. So Else is asking if you can share the slides. We will record, so we will have the slides there. But maybe you can share the slides with the participants.
Yes, I can send you after the slides, or to Maiken, and you can share it, because I think I'm not such a.
No, please send it to us, and we will share.
You can put it also on the website. I don't mind. It can be also make public if it's okay for you. You can put it whatever, so everybody can download it from the website. I don't know which way you want, Astrid. It's like maybe it's sometimes easier for the people to download the slides.
We can do both, yes.
Yeah.
Right.
So this is not a. I'm happy if it helps in some way. So, but as I said, I think in future when we learn to talk about this, then we should need to go like deeply in the topic, and then we could make a sexuality in, let's say, in young.
Yeah,
I think it's different juvenile, it's different like early pre-manifest stage, advanced sexual problems, whatever pathology. So it could be.
And what we did in Bucharest when you had it at our conference last year was really having first the talk and then some discussions in smaller groups with people in more of the same relation to the disease, which I think people found really useful. To be able to discuss with others in the same position, so to speak, as themselves. So there are many ways to do that, but definitely we can also make kind of subtopics.
One of the comments in Bucharest, I was at the professional session. Many professionals said it was the first time they were really speaking about this topic. And it was a very large session. But many of the people there, remember Alzbeta, many of them.
The session was very big because I was very surprised. We were like sitting there like almost 30 or 40 people.
Yes, and many people said that it was the first time they were ever speaking about this topic related to HD.
It looks like this, that the psychiatrists are more open to talk about this somehow, as the different professionals. So psychiatrists are somehow either we are crazy or whatever.
Yeah, no, I think that's actually the case, because I was very surprised. We were talking about a study where you were supposed to collect sperm from males with Huntington's disease, and I heard doctors saying they found it very hard to ask their patients for sperm because it was so difficult to bring up. And I was like, really? Is it that difficult for you? Then it tells me something about maybe they are not comfortable discussing sex life, with their patients. So they need to train. We need to train as patients or whatever.
The HD community needs to train them.
Yeah, exactly. Yeah. So thank you, Alzbeta, for helping us to train tonight. And
yes, I get you the presentation immediately, and you can share. It's not a problem.
Thank you very much.
Yeah.
And I think if we don't have anybody else who wants to comment, people are thanking you in the chat. And
I know. Thank you very much, everybody, for listening to me. And next time we get even better.
No, it was really good.
It was very good. Yeah.
Thank you.
We will come back to it at a later point in time. That's for sure.
Bye.
Yeah.
So take care, everybody.